Welcome back. Joining us now in the studio today is Dr. Alexandria Fan, who is the Cancer Center Director of UT Health North Campus Tyler, MD Anderson Cancer Center. So thank you so much for joining us here this morning.
Thank you.
So tell me about yourself. What do you do?
I'm a hematology oncologist. I have about 20 years plus experience as a specialist in treating cancer of the GI tract or neuroendocrine tumors. I have been at MD Anderson in Houston for about 13 years, where I taught, do clinical research, and take care of these patients with rare malignancy or GI cancer. I came to East Texas in January of 2019 to be the Cancer Center Director, and since I've been here, there's a lot of new and exciting things that we have seen happening. One of the things is that I observed that patient with neuroendocrine tumor has to be sent to either Houston or Dallas to get a diagnostic testing. Tumors that is called neuroendocrine tumors are rare cancer that arise from either the endocrine or the nervous system, and they can be fatal. They can be cancerous and fatal, but these patients shouldn't go to Dallas or Houston to get diagnostic screening. So we actually develop a program that actually allow patients to both get diagnostic scan, as well as a targeted therapy program for neuroendocrine tumor patients. So beginning of actually June 2019, patient can be scanned that has neuroendocrine tumor, get diagnostic scan in East Texas because of our effort. As well, we'll be starting treating patient with neuroendocrine tumor in the beginning of March 2020. So this is a huge success. So that's what I've done since the time I've been here.
That's incredible. I mean, because obviously medical costs can just be a nightmare and completely unexpected to many families. Nobody plans cancer or anything like that, but also having to drive to these metroplexes for treatments, scanning, all of that. I know that can be a huge help to people in our area going through this. So tell me more about this targeted treatment option.
Targeted therapy, this targeted therapy for neuroendocrine tumors are called PRRT. PRRT stand for peptide receptor radionuclide therapy. It's a new therapy that is introduced or got FDA approved in January 2018. It's relatively new in the US. Actually, what it is, it's comprised of PRRT comprised of a targeting molecule with a radioactive component. What it does is that it's injected, it's given by IV intravenous into the bloodstream. Once it gets into the bloodstream, the targeting molecule essentially seek out and attach to a receptor on a tumor cells, dragging along with it the radioactive component. Once it's attached to the receptor, the cells, the tumor cell, will then engulf or ingest the whole molecule into the tumor cells. Once into the tumor cell, the radioactive component will release radiation, killing only the tumor cells. Because it is specific and targeted, it has less toxicity than chemotherapy that is not so specific. So that's what we call PRRT, which is considered targeted radiation therapy for neuroendocrine tumors.
Real quick, so is this applicable to any type of cancer or just those certain ones?
So PRRT right now has an FDA indication only for neuroendocrine tumor that express or overexpress somatostatin receptors.
All right, well, thank you, Dr. Fan, for joining us this morning. For more information, you can see it right there on your screen. Go to uthealtheasttexas.com.